You can now identify some signs of early deterioration. But what actions do you need to take when a client is deteriorating? Remember that as a care worker, you have different obligations and responsibilities compared to a healthcare professional, so your response to a deteriorating client will look different. A good framework for monitoring changes in a client is the Stop and Watch Early Warning tool. The Stop and Watch Early Warning tool assists care workers to recognize potential changes in a client's condition and allows these changes to be communicated to nurses and supervisors in a clear, simple way. Stop and Watch is S. Seems different to usual. T. Talks or communicates less. O. Overall needs more help. P. Pain. New or worsening, or P, participates less in activities. A, ate less. N, no bowel movement in 3 days, or diarrhea, not usual bowel movements. D, drank less. W, weight change. A, agitated, or more nervous than usual. T, tired, weak, confused, drowsy. C. Change in skin color or condition. H. Help with walking, transferring or toileting more than usual. To use the Stop and Watch Early Warning tool in written documentation, you should circle the letters corresponding to any changes in the client's condition that you have noticed. For example, if you notice that a client has a decreased appetite, you would circle the letter A in AND. You should also describe the change you have noticed. For example, reduced appetite for 48 hours. You then need to write you and your team leader's names and provide your team leader with a copy of the form. The registered nurse will then perform a clinical review of the client. This process will include checking the client's vital signs and GCS, communicating with the client's general practitioner or other health professionals, and notifying the client's family about their condition. In addition to using the Stop and Watch Early Warning tool, you will also need to communicate the client's basic vital signs to the nurse in charge. The following vital signs should be regularly monitored and brought to the attention of a supervisor when they are abnormal. Note: some clients may have limits set by the client's healthcare practitioner. For example, a heart rate of 100 may be normal for a particular client. Respiratory rate. An abnormal respiratory rate is typically considered to be less than 10 or more than 20 breaths per minute. Additionally, respiratory effort needs to be observed as well. For example, obvious distress or cyanosis. Oxygen saturation. Oxygen saturation is often measured through a pulse oximetry and can be used to help identify the effectiveness of oxygen therapy. The normal range of oxygen saturation is considered to be a peripheral capillary oxygen saturation, SpO2, above 95%. However, this may be different for clients who retain carbon dioxide, such as people with a chronic obstructive pulmonary disease. In these clients, SpO2 aims may be between 88 and 92%. Blood pressure. Blood pressure describes the force of blood as it flows through the artery walls during contraction and relaxation of the heart. It's measured in millimeters of mercury, shown as mmHg. This vital sign takes into account systolic and diastolic measurements. Note: systolic pressure refers to the maximum pressure on the arteries during left ventricular contraction, the top measurement. The diastolic pressure refers to the resting pressure on the arteries between each cardiac contraction, the bottom measurement. A normal systolic range is between 100 and 140 mmHg, while a normal diastolic range is between 60 and 89 mmHg. High blood pressure, hypertension, or low blood pressure, hypotension, are signs of clinical deterioration and must be responded to appropriately by medical staff. Manual blood pressures should be taken to ensure the accuracy of the results. Blood pressure can also be measured from lying to standing to determine if there is a postural drop. A postural drop increases a client's risk of dizziness and falls. Normal blood pressure ranges depends on the person's age and fitness. Heart rate. The normal range for a person's heart rate is between 60 to 100 beats per minute. This result may be influenced by factors such as fitness level, age, illness, and emotions. When measuring heart rate, one can also note heart rhythm and strength of the pulse. Temperature. Body temperature can be measured in a variety of ways, including orally, rectally, axillary, tympanically, or through scanning the skin on the forehead. A normal range is considered to be between 36.5 and 37.5 degrees Celsius. Blood glucose. Blood glucose level, BGL, is an important observation, as an abnormality can lead to various adverse outcomes. For example, hypoglycemia, low blood glucose, can cause confusion and headaches, and if left untreated, can lead to unconsciousness and brain damage. Hyperglycemia, high blood glucose, on the other hand, can cause diabetic ketoacidosis, DKA, a potentially fatal condition wherein the body breaks down fat for energy and produces acids known as ketones. BGL is measured in millimoles per litre, shown as mmol/L, and a normal range is considered to be 4.0 to 7.8 millimoles per litre. Although people with diabetes may have different individual target ranges, as discussed with their general practitioner. State of consciousness. The AVPU scale is a rapid assessment tool that can be used to quickly measure a client's level of consciousness. A stands for alert. The client is aware of the environment and can open their eyes spontaneously. V stands for verbal. The client's eyes do not open spontaneously. They only open in response to a verbal stimulus aimed towards them. P stands for pain. The client's eyes do not open spontaneously or to verbal stimuli. They will only respond to painful stimuli directed towards them. Touch the client, and if there is no response, you can attempt to apply a painful stimulus such as the trapezius squeeze. U stands for unresponsive. The client is not responding spontaneously or to verbal or painful stimuli.